Hello ladies and gentlemen, and welcome to your crash cart crash course review. Alright? This is the crash cart. It's red. It's easy to locate. On top, there should always be the defibrillator and your intubation box. Then we've got the separate airway kit on top. On the side, there's helpful stuff that a lot of times goes unlooked. If you're ever alone and you don't have a physician with you, and you're having trouble remembering your ACLS stuff, every crash cart should have these ACLS algorithms that you can flip through just as a refresher in the moment. Also on the side, you'll have defibrillator pads for when you have to use your manual defibrillator. And you should have pediatric electrodes, and you should have adult electrodes. And the kind that we use up here in MI, it'll show the hookup that we have to make sure that it's compatible with our monitor. In addition to that, you'll have your ECG electrodes on the cart. There's also supposed to be several rolls of extra paper to put in the monitor. Alright, so that's the outside. In order to get inside a lot of these crash carts, they won't open at first. You have to come down to this bottom door. You've got to make sure it's put all the way open and pushed all the way closed, and then it'll allow you to access it. Top drawer, you've got your ACLS drugs. One of the important things about this crash cart, and especially this med drawer, is that if you understand what's in your crash cart, it decreases a lot of the chaos that we have in these codes where we've got people running out of the room, across the unit, going to supply rooms, going to the med room, looking for drugs, trying to mix drips. Almost everything, 90% of the stuff you're going to need for a cardiac arrest is going to be in this crash cart. Okay? An example of that is, in addition to the typical drugs we have, like the pre-mixed epinephrine, the pre-mixed sodium bicarb, atropine, all that sort of stuff, you've got these large vials of epinephrine. So if you run out of these 1 milligram per 10 ml vials, you can pull up 1 cc of this, the 1 to 1000, and then pull some flushes and mix your own 1 to 10 epi and leave it at the bedside. You can also use these to mix an epi drip from the bags at the bottom of the crash cart. You've got 2 vials, 2 4 milligram vials of Levophed that instead of running to the med room to mix a bag of Levophed when you need it, you can use these in a 250 bag from the bottom of the crash cart. And you've got your own pre-made Levophed there at the bedside without having to run out of the room. Okay, that keeps all your resources in one place. Like I said, decreases the chaos, decreases the yelling and the screaming and the running around, and that makes for a better, quieter code. Alright? Next drawer, you got everything that you need for IV starts, lab draws, stuff like that. One important thing that we miss in a lot of codes that we've been really good up here at Medical ICU with is IO needles. In the current ACLS, they're recommending to go to IO very early if you have trouble getting access. And that can still be a problem in our unit, though we've got capabilities to do central lines here in the ICU. Those can take 10 minutes or more sometimes, especially in someone in vascular collapse. If you grab this IO needle and are able to place it, and we can go over that training later, you've got immediate non-collapsible vascular access that you can push any drug that you need to through. The only downside of these is you can't do lab draws from them because it's bone marrow, not blood. We've got 2 of those in each of these crash carts. You've got all of your IVs. You've got large syringes. You've got medium syringes. You've got all your needles, your IV caps, extension tubing. You even have art line, radial art line gear in here. And you even have tubes to collect your blood in and send it off. So, like I said, you got everything for lab, blood draws, and stuff like that in this drawer right here. Drawer number 3, they call it the Airway Ich Drawer. You've got gastric tube, some sterile gloves. You've got restraints because, you know, people in cardiac arrest always need restraints. You've got an emergency trach kit. Inside this kit, this one, not all of them are see-through like this, so we'll take a moment to look at it. You've got 2 different needles, and then you've got the trach with the introducer on there. Probably not going to see this used up here since we have our own perk trach kits, but it is here in case you do help respond to a code on the floor where they need that. You've got some deep tracheal suctioning kits, 4x4s, benzoin, a razor. I don't know how to use that, but maybe somebody else can train you. And some suture kits. In addition to that, you've got a non-breather in case your patient is actually able to breathe. You've got some nasopharyngeal airways. Fourth drawer is the PD drawer. This has got all the stuff in case you respond to a code in a pediatric floor. Hopefully we'll never have to use this here, but we do have pediatric patients, not patients but visitors sometimes, and you know, strange things happen all the time. So anyway, it's got all of your smaller modified stuff, smaller blades, pediatric McGill forceps, laryngoscope and everything in there. One of the most important things you could probably glean from this drawer is it's got a Broslow tape. Some of you may not know or remember what a Broslow tape is. It's basically a long tape, I know you can't see the whole thing on the video, that you put and it gives instructions on how to place it on the patient. It's used to measure, and wherever their body falls, it's got your whole list of dosages, their weight and the dosages of the drugs and the size of ET tubes and everything like that. And that keeps you from having to think too much in a code, and can help save lives because us adult ICU nurses don't know pediatric doses right off the top of our head very well. It's also got a lot of airway stuff, trachs and things like that, all pediatric specific. One of the more important places on this crash cart is down in the bottom. It's kind of a treasure trove down here. And it's got a lot of extra stuff that we use very frequently, okay? It's got a central line kit, so you don't have to run and get one of those. It has the pediatric drug box with PD specific doses and drugs. It's got this really strange long op site. I'm not really sure why you'd ever need that, but it exists in here. A couple other things that we have down here. You've got pre-mixed lidocaine bag in case you need to start a lidocaine drip on someone who's been having a lot of ventricular rhythms. You've got multiple sizes of IV fluids. 1,000 and 250 of saline, another 1,000 of saline, a 250 of D5. You got some 250s of D5 and saline, even more. There's some 100 bags of D5. You've got suction tubing and a Yonker catheter. And you've also got a pre-mixed dopamine in the bottom for pressors. So with all this stuff in this crash cart, that should get you through the initial, 30 minutes of a code if it's run properly. Should be able to keep you in the room, keep you focused. That is Crash Cart 101.